The following is brought to you by VerticalVet. Rethink your GPO.
Hello again. I am Dr. Ernie Ward, Executive Director of Education for VerticalVet, and I am thrilled to be with you today because we are going to talk about something that needs to be talked about more in the veterinary profession, and that is humor, laughter, having fun, decompressing, trying to take some of the edge off of the day-to-day grind that so many of us can relate to. And today, I can't think of a better guest to talk about laughter in veterinary medicine than one of our dear friends and a partner of VerticalVet from DVM 360, Dr. Adam Christman. Now, you probably know him from his social media, very popular posts with his Dachshunds and all the crazy things they get into. It is adorable. If you don't know what I'm talking about, he's going to tell you about it, but we'll have links, I'm sure, in all the show notes. But Dr. Christman is going to join us as part of this partnership that VerticalVet and DVM 360 have going on. So if you want to find out more about some of the opportunities and offerings that we have, definitely contact us at VerticalVet. But again, today we want to make a little light of some of the problems that we're dealing with. And more importantly, I think we want to provide you with these skills to cope, because at the end of the day, veterinary medicine, veterinary practice is incredibly stressful. It's an emotionally charged environment, and most of us need a little help getting through some of the hard times. So today I'm thrilled once again to introduce you to Dr. Adam Christman. Adam, thank you so much for being here.
Hey, Dr. Ward, thanks for having me. It's an honor. Thank you to VerticalVet for having me as well. This is great. This is awesome and catastic. I had to do it.
Hey, pet puns are welcome, especially today. And VerticalVet family, a lot of times we're bringing heavy medicine to you guys. We're bringing a lot of, the cutting edge business. But today it's going to be a little different because honestly, no matter how good a surgeon you may be or diagnostician you are, and I don't care how good you are at crunching numbers and making profitability, if you're miserable doing it, Adam, I think that's misery right there.
Exactly right. Exactly right. I mean, this is up there with your mental health and well-being and culture for your practice. Right. I mean, nobody wants to come to work with a negative Nancy, Debbie Downer, whatever you want to call them, but you have to try to have some of that humor, and that's what we're going to chat about.
Yeah. So, Adam, I think the first place to start is, look, we are a very didactic profession. I mean, you and I went to vet school along with our veterinary technician colleagues and others, and we learned the facts, right? And so let's start off maybe by talking about the facts, the science behind how humor can actually elevate your mood and maybe even improve your health.
Yes. I mean, let's get into it. So did you know, Dr. Ward, that like 15 to 20 minutes of laughter is equivalent to 60 minutes of exercise? 60 minutes of physical exercise. Yeah. So it's just as important. That belly laughing, that emotion, those endorphins that are getting released from laughing are just as important as everything else that we're exercising. So they have wonderful studies on humor, laughter, and physical health, the methodological issues and research findings that are there. They're seeing the science that's there. We know what it feels good, having that mindset of laughing, the physical ability to laugh at and not taking yourself too seriously at the same time when it warrants itself. So we know that there's a lot of great research and studies that are out there. And, we're not here to bore you, but we're here to actually let you know that there really is a science behind it. And I've always liked to read some of these magazines and journals that talk about it because it does make sense. It's just as important, like I said, as, when we're checking in on each other. And it's nice to have a little humor because let's face it, don't you want to be around those people? I mean, right?
It's the only reason that my wife has kept me around all these years. I think I do things that make her laugh. She laughs more at me than with me, but hey, whatever works, right?
Right. It really is. Listen, whatever it takes. But when you're coming into work, people especially with what we've been going through these past couple of years, it's rough. So you have to try to make the best of the situation. Check in often with each other, but then also find light. Let me tell you something. I was talking to a comedian and he said, can I grab some of your content? Because veterinary medicine is full of content. So many things. Like, where else can you be in a waiting room and a dog drops the number 2 and everyone stops what they're doing to say, do we need this? Before everybody else normally be like, oh my God.
Yeah, if you pull that in a pediatrician's office, it's a very different conversation. And I might have actually been involved with one of those scenarios over time. Well, Adam, again, but getting back to the science, and I agree, there is mounting evidence of the positive health benefits of laughter. And, what I'm seeing now also is it being incorporated more into traditional medical practices. I mean, a lot of times when doctors are dispensing advice, like saying, hey, listen, you need to relax, I think they're also saying lighten up.
Yes. Lighten up. I feel like we're notorious in this profession for taking ourselves so seriously. We wear our heart on our sleeves in this profession. We entered this field because we love what we do and we really care what others think of us. And so with that being said, sometimes you're a little more self-conscious of yourself. But I really have learned from several of my mentors to say you really cannot take yourself too seriously. Be your authentic self, and life is too short, and make the best of these human interactions that you have with one another. And I do think that the reason why I stress that to the audience is because you can have so much fun with pet parents too in the exam room. You can joke when it's important, when it's appropriate, of course. You can have some really good, easy humor. I mean, like, I've had dogs that would just slobber me up, and you're like, you could either be like, this is just awful that I've slobbered, and otherwise you could be like, look how messed up I am. Right. You just have to change your mindset and have some fun with the humor. When you're doing an anal gland expression too, and you accidentally hit the wall with it too, and you're like, oh my gosh, should we put a target up here on the wall? Like you need to have those kinds of interactions and those levity moments. I think it warrants itself with what we do day in, day out. Super big highs, new puppies, new kittens, serious problems, emergencies, end-of-life care, hospice, palliative medicine. So I think it's important to try to find that humor through your day-to-day.
Yeah, and then again, like you said, allow yourself to find the humor, because I think too often we've treated it as a net sum zero. Like we play to the extreme edges. It's like, well, we're serious medicine. I'm a serious veterinarian. I'm a serious vet tech. And therefore, if I allow humor to creep into my day-to-day existence, then I'm going to be taken less seriously. Again, getting back to viewing how people, worry about what the world sees them as. And I think, Adam, again, I'd like to give permission to all the veterinary professionals out there. It's okay to find brevity and levity in the workplace. And like you said, know the boundaries. I mean, you don't walk in on a euthanasia and say, hey, it's the last day of your life. How's it going? I mean, you can't be an idiot about it either, right? No,
you can't. Know your audience is really what
know
what
your
we said.
audience, right?
Right. Know your audience, because of, there's a lot of sensitive issues that are currently out there, but what's not that's all fair games are animals too. They don't care who you love, the color of your skin, whatever it is. So you have such great content with your patients. They're so much fun. And I really do believe this, that, yeah, you're right. You're bringing up a good point, because you feel like you're not going to be taken seriously. You're not going to be respected from your colleagues or superiors, wherever it is. But I completely disagree. When I sat in a lecture learning about this on humor, on the human side, it was a human physician that talked about this. And he said, you are taken more seriously, you're more respected because you're being human. You're being human. You're showing the human emotions that are out there. And laughter is a big part. That's what we yearn for, you and I. When we go out for drinks and we hang out, we want good laughs. We want good interactions and experiences. That's what your clients want. They're not coming to you because they're looking on your website to see all your credentials. They're coming to you because they want to evoke an experience. They want your expertise, but they also want to see that bedside manner, that ability to connect and have some fun with them.
Yeah, and I really want to repeat what Adam just said, because that's so important to this conversation. Good bedside manner is not only empathetic, and caring and concerned, but it's also the ability to have a little fun with it, because, again, people enjoy their pets. I mean, not a day goes by that one of my terriers doesn't do something hilarious, right? And sometimes the cat gets involved with it as well, just like your Dachshunds. I mean, so I think that we need to celebrate and integrate ourselves into those opportunities whenever they present. And again, like Adam said, know the audience, know the boundaries. I mean, this is contextual. There are certain times when it's wholly inappropriate to make any kind of remark that could be construed as humorous in any way. And then, of course, there are other times when it's like, holy smokes, this is too good to pass up. And if you do pass it up, you may be seen differently by that client, because they may go, what? I mean, I thought it was funny. My dog farted, when he was checking his backside. I mean, you gotta go with that moment, I believe.
You really do. And again, so I know my audience, you know your clients too, and you can kind of know which ones are you can really joke around with. So for example, a fun thing that anybody can do, and again, know your audience with this, but whenever, because you know spaying and neutering can be a little scary to a pet parent. They're like, oh my gosh, I'm really concerned about this. I don't want the testicles to come off. So I send out evites to a testicle festival with the dog's name. So I said, Max is cordially invited to his testicle festival at 7:30. Sorry, Max, no food for you. You know what that did? Everyone was sharing that, talking about it, loving it. The fact that like you're in good company, we're going to take care of you. And we did one for Out with the Lady Bits for Spay Day. And we just try to like make sure that, yes, there's a science behind it, the why behind it, of course, but we never got anybody to say, oh, this is ridiculous. They loved it. So, I mean, that's something easy that you can do with some of your audience, your clients that you would know.
Yeah, and I agree. I mean, like going back way before your time, Adam, but the My Big Day, kind of celebrating the spay and neuter. I mean, we were trying to find those little bits and pieces that we thought people would relate to. And again, Vertical Vet family, what we're saying here is, every vet can do a spay or neuter, and the public actually says it's all about the same, right? You're taking out the lady parts or the male bits or whatever Adam said. That was hilarious, right? So they say there's the bar, right? But guess what elevates you and distinguishes you and differentiates you in your area? It's the humor that he just brought, or whatever that little extra layer. So if you think that, they're just going to go, well, you're a capable and competent vet because you spayed my dog, that's not going to be good enough, I think, for that loyalty, right? I mean, I think this is what really enhances that relationship. Well, Adam, as we sort of talk about this, I mean, I do agree with you. There's mounting evidence about the benefits. We've sort of said, okay, in the scope of day-to-day, there may be an opportunity, but there are many veterinarians who just don't see it as appropriate. And I would say that our profession is pretty change resistant in general. So let's say somebody's watching this today in whatever position or capacity in a clinic that you may be, and they're saying, okay, I probably should lighten up. Maybe I am too serious and stern in the day-to-day. How can really adopting and adapting to more humor in their life help them change their whole mindset?
Well, you brought up a good point. So veterinarians and change? What? We don't even like to change our heartworm prevention, let alone try to change something that would evoke like humor to it. I get it. But I challenge our colleagues with this. When you drive home, you want to be able to decompress and have you obviously feel fulfilled, but you also want to make sure that you're not burnt out. And how do you do that? Well, one of those ways you could do it is to have a little levity throughout the day. Some of those highs and lows, when somebody says, tell me about your day, I would say, oh my gosh, Jen had the funniest joke that she was telling me that I have to tell you. This was so good. It's not really where I changed my mindset realizing yeah, I did 4 euthanasias that day. And that can be kind of want and tough, but it's good for people to understand where your mindset is from. But I want really good memories, so whether it be a fun team meeting that we had where we had to go around the room to say, I need everyone to tell me your silly joke or silly pun. The best one is going to get a gift card to Amazon for today. And I've done these things. And I think it's what really creates a sense of humor. And you kind of know where everybody's coming from. So it is hard to go outside of your comfort zone. But maybe those of you that are tuning in, you could be that change agent for your practice. Very subtle too. And it could be simple things like really, really cute little funny jokes too. I have a dry erase board in the back. You can put your funny joke of the day. You can even get the tear-off calendars that they have, which I have, the 365 ones. And you can just write right there and see what the response is from your team. Haha, so cute, not funny, whatever. Oh, you again with the dad jokes, But you're creating a culture. Okay, and I'm going to say that one more time because this is really important to those of you that are tuning in. It's one thing to have humor, but it's another to change the culture for the better. And we do live in an environment that's stressful. We know. You and I don't need to have to talk about that. We know that. But how do we do it? Very subtle. These are really simple, easy, and effective solutions that any practice can do. And all it takes, Ernie, is one person to make that change.
Yeah, I couldn't agree more. Really well said. And I would also say there are veterinarians who are reticent to bring humor into their clinic because they think that their staff won't know the boundaries, right? They won't understand the context or the audience, as you're saying. And I will tell you this right now from my experience, and I would love to get Adam's take on it as well. That's rarely the case. Like, rarely does your staff suddenly go, okay, well, I'm going to go start cracking, blue language jokes in the exam room. I mean,
right.
I've never really encountered that kind of extremism. And I think that's what really fuels the fear in our minds for opening our clinics up to humor.
Right. Let me ask you and the audience this too. What are some reasons why employees leave their place of business? They say they don't leave their jobs, they leave their bosses. Is it because of mismanagement? Is it because of not enough pay? From what I also hear is that it's not fun. It's not fun. I rather work in an environment that's fun, progressive, that gets me. And so one of those ways that you can be a differentiator from other hospitals that might be out there that you all have heard this. You all know that there are certain clinics, unfortunately, that are like, it's just so rough. The workforce is toxic. You hear that often, and there's other reasons that go into it. But for humor, you go in, it's like, oh, I like going to Dr. Christman. He's a lot of fun, because the clients will say to the client, is he this funny on the other side of the door? And they said, oh, you have no idea. Like, you're only getting 20 minutes of what he's saying. Like, I got 8 hours with this guy, and it's a lot. So, but that's what you want to hear, because you know what that means? Clients are going to keep coming in because they want a little piece of that fun. And so, again, know your audience, know the time, of course, but this is a general statement that we're talking about, because that trickles down to create your employers are going to feel more motivated to be there and to do well for your whole team.
Yeah, I love that, Adam. And one of the things I've been frustrated with our colleagues over the years is every time, like, I would bring a new idea out, whether it was staff leveraging or weekly staff training meetings, whatever the thing at the time back in the 90s and early 2000s I was bringing out, people seem to think that it was exclusionary to everything else. Oh, so now you're leveraging your staff, so your doctors aren't going to do anything. What? I mean, it's additive. Oh. This is an amalgam. So adding humor in doesn't mean that you take expertise or seriousness out, right? I mean, I don't know, Adam. That has been my biggest frustration. Is like when I know that there are going to be people watching this and they're going to say, okay, well, so if we start having fun in the clinic, then we'll do terrible patient care or client service, and that's just not the point, and that's not true.
No. It's not true at all. It's not true at all. In fact, I think it's counterproductive. If you're too serious, your employees are going to burn out and they're going to leave. And so, like, yes, it's important to maintain professionalism, but you could do this in a law firm. You could do this at human physician offices. You see it everywhere. And I laugh when I go to my own doctor. I want to have a great experience too. And he makes some great jokes and cracks some great comments, and I love it. So that's what makes me want to come back for more. And that's what you have to have your change mindset for that. I agree with you, Ernie. Like, it aggravates me when I go and talk to other practices and I said, tell me about your team meeting. They're like, ugh. I said, why did you just open up like that? They're like, oh, they're so boring, and we always feel like we're getting in trouble. I'm like, really? That's not what a team meeting is supposed to be for. Right. Like, change that around a little bit. Tell me your best joke. Tell me the highlight of your day. But, I think humor is a huge, huge thing. And you can inject some great one-liners from TV shows that you see. I mean, our profession, I feel like we love Friends, we love Seinfeld, we love a lot of things back in the 90s. And so there's a lot of great one-liners that you can keep using that are totally clean and appropriate. But people are like, oh, I love that show. Remember that episode when she fell down the stairs? Like, it's making people create a connection, and that's important.
I love that. Now, years ago, I did an article on one aspect of humor that I think bears a little bit of caution today. And I wrote an article about the danger of sarcasm in the workplace. And I think, I don't know if this is 20 years ago, so who knows what the evidence is today. But, sarcasm is one of those those tools, those types of communication devices where, if directed from a leader, can be viewed as condescending, intimidating. There's a lot of potential damage that can be done with sarcasm, especially from a leadership position. So I think that, if you're sitting there thinking, well, I don't know how to be funny. I would always err, as I said in the article, err on the side of self-deprecation. Like, leaders that actually can say, oh my gosh, I'm a goofball. I really messed that. When you can make fun of yourself, you're taken more seriously as a leader. And I think you kind of touched on that earlier. So maybe we could revisit that.
making a joke so you can feel better about yourself. Like, and all of you have done that. We've all experienced something like that. You try to joke around. Another example is when you have a client that comes in, and we make these preconceived stereotypes too. Like, you have a woman that maybe, or a man that has like no money, but and they have an English bulldog. Like, oh, they're in it for the long haul with the skin and hips and eye issues. No, that's not what we're talking about here, because that's passing judgment. That creates a little bit of poison. You're right. And I think effective leadership is like, oh my gosh, I cannot get a catheter in this dog. Can somebody please help me? Knowing your humility and not being like, oh, I got this. I could do everything. And then seeing a technician that can throw like an 18-gauge catheter in a 20-year-old dehydrated kidney failure cat is like, oh, amazing. And then when I see that happen, I make a bit, I'm like, what?
Right. And look, I truly admire sarcasm. Like, I like seeing it on the screen and television, in other people. However, in the workplace, like, that's one of those things that I really had to learn as a young practice owner, that, wow, this is loaded. So I need to maybe avoid that as much as possible. And it really did change my mindset, Adam, because I started saying, like you said, not making fun of other situations that were not involving me and really turning it on myself and everything, that unlocked a lot with my teams.
Right. I like that you said change your mindset, because a good soundbite that I said is change your mindset to teachable moments. So, for example, if Jan's late to work, like, oh, that's just so typical of her. Maybe not. And so I changed that. If I was to be a leader and saying that Jan's been consistently late, I said, I'm a little worried. Is everything going okay with Jan? Versus, oh, well, she's always late. That's not okay. So effective leaders do those things by changing their mindset. And then also making sure she's okay. So when she comes in, and then here's a fun thing that we always do. I don't know if you did this already too, but if you have an employee that's running a few minutes late, the rule is you got to get everybody a breakfast snack. So
yeah, there are a lot of penalties issued in my tenure over the years. So, and you're right, and kind of turn into a positive. Now, obviously, and again, this is where it drives me crazy, because there are people going, oh, so you don't, if somebody's late all the time, you just make fun of it. It's just a funny thing in your clinic, ha. That's not what we're talking about. We're really talking about the exceptions to the rule. If there's a client who is consistently late, that's an entirely different issue, right? I mean, that's going to be a disciplinary action, not something that we say, all right, you owe everybody, a donut, right?
Right. Yeah, okay. You're exactly right. There's so many different outliers, as you and I know, too, with employees, within clients, and then having those boundaries, healthy boundaries, too, to know that there's a fine line between joking and then also making sure that there's expectations that are met, both from a client as well as an employee's perspective.
So again, I know you've touched on it, bits and pieces here and there, but what are some more good examples, of when you think humor is a positive influence in a workplace? I mean, any examples maybe you could share with us?
Yeah, so I think a big thing is when you start your day, okay? So when you start your day, try to find one humorous thing that you can experience and share that with the team. So you all have your huddles or whatever it is that you have throughout the day. So when you come into the mindset, I said, I got my, because this is what I'm known for, Ernie, is my silly dad jokes, So I said, what did one hat say to the other hat? And you got to have good delivery too. What did one hat say to the other hat? You stay here, I'm going to go on ahead. And they go, oh, can we go back into appointments? I don't care. I love it. So then I challenged them. I said, okay, it's your turn tomorrow to come in with one. So a silly joke, a silly pun like that, super easy to do. And then also, like I said, everything behind the scenes. So your backstage should be loaded with some fun area for these employees to enjoy and decompress. Very important now, more so than ever. Dry erase board. Put a little silly joke in the jar. Announce them over at a lunch break, or do it at your monthly team meetings. You could even do this virtual. And then you can have your clients, I did this once, have your clients vote on the best joke of the week on social media. And so whoever gets the winner, gets a gift card, nothing crazy, but it's fun just to post these really fun, jokes. So those are really good things of making people feel good. I'm all about, I've always was taught this way. My parents, thank God my parents instilled this in me, to make people feel good about themselves. That's what we do in that, is just finding some humor and a connection.
Right. And that's what it is about, Adam. I mean, it is about helping other people feel better about whatever's happening in their life. And I think that's what we owe them minimally as an employer. I think that's the minimum bar. It's like, can we make you feel better?
Right.
I mean, we may not be able to pay you what you want, but, or what you're worth, but,
And humor can be in different facets too. It doesn't have to be necessarily a joke. I've done these things where you can have these images on the back to see, identify, the missing objects from one picture to the next, really cool brain teasers, puzzles, like that all injects really good humor because of the fact, like, oh my gosh, did you see that Adam couldn't get that puzzle right? Like, what? And I got it right in 5 seconds. So like it creates a conversation and humor in and of itself. So I challenge all of you that are watching to do teasers and brain teasers. We love those kinds of things. It challenges your brain a different way. Put that up on a dry erase board, hang it in the back in the treatment area where they're clocking in, put it in your newsletter. You got to have that consistently. I really believe that humor is part of an artery to your practice, and it needs to still consistently be fulfilled and pumped and injected through your audience as well as to your team with like great fun and levity throughout the day.
Yeah, I couldn't agree more. I love that. It is an artery from the heart to the brain, and without that pumping all the time, something is going to break down. Adam, one other quick thing too, just to touch on, because I mean, you're a naturally funny guy, and you've had a lot of experience in public speaking, and so you've got the skill set that a lot of our colleagues don't, and I just want to make sure that they don't walk away saying, I'm not a funny person. I've tried it, because I think we all have the capacity for humor. I don't think you have to be Jerry Seinfeld level or whatever, right? I mean, you can just be funny in your authentic self. So maybe you could touch on and give some advice or maybe reassurance for that person who's watching who says, I'm not funny. People don't find me funny.
Yeah, you are funny. Think about your conversations that you've had with your classmates, your friends. And, I know some of us take it so seriously when we're at work. My best suggestion to you, my friends, is just to kind of scale it down a little bit. Scale it down a little bit, because you need to decompress or you're going to burn yourself out. You're going to burn yourself out. So you got to have a little fun with that. And so I think in finding a little humor throughout your day is so, so important to do. And there's, like I said, animals make you laugh. It's why we love the human-animal bond, right? They make us laugh. Now, listen, I am the king of one-liners. Like, I don't know how that happened, but like, I'm very quick with my jokes. You don't have to be, but I do challenge you to look into storytelling, because storytelling will always tell you something about levity and a joke. So if you have a hard time trying to find something humorous, I really look into some books on effective storytelling. I'm sure, Ernie, you're very good at this too. Telling stories is great because you can give a great sense of humor, a joke, but then you can also get your point across at the same time. I'll give you an example, and I share this with my clients when I go on live. I said that, I had this male dog that came in, and 4-year-old Labrador Retriever, and the technician walks in the back. She's like, Dr. Christman, I'm not an idiot. She goes, that is a male dog, and he looks pregnant. And so I was thinking to myself, okay, maybe it's bloat. She's like, it's not bloat. I can tell you it's not bloat. She's like, something is seriously up. And so I was like, really? So I go into the exam room, and no joke, this dog did look completely pregnant. Well, cut to eating a little bit of Gorilla Glue. Now, this is when I first started practicing. I didn't know that Gorilla Glue does this whole thing, like it expands, right? And I said, Kelly Clarkson, like, what happened? She's like, he only ate like a little bit of a teaspoon. But I bring him back, and he did fine. We took him to surgery, peel him all out. But the point of that is sharing a story of humor. Like, oh my gosh, this could be, ridiculous. Like thinking that this dog was pregnant. But at the same time, we talk about toxicity. You just don't know what these animals can get into. But storytelling really does help. And so I do think there's something to be said about effective storytelling that can inject a little sense of humor for those of you that need to work on it. Yeah.
And again, I will maybe put it on my tombstone. There's a bunch of stuff they probably need to put on my tombstone, but we don't lecture to clients. I mean, I know that's how we were taught, and that's really what you've been exposed to and ingrained in you since you were a little kid. But when you're in the exam room one-on-one, it is about storytelling. And I know we've been saying this for 25 years, but Adam, I think it just bears repeating once again. It's the spinach in your diet that you just need to eat every day. So yeah. Okay, so as we kind of wrap up today's conversation, I think one of the things that you have impressed me so much with over the years, and there's many things, but is your ability to sort of take on the role of pet parent, even though you're a serious veterinarian. And I'm referring, of course, to your social media, content where your Dachshunds are just, the highlight of millions of people's day, right? I mean,
Yes.
So maybe explain a little bit about that role and how we need to make sure that the world sees veterinarians as just goofy pet parents like the rest of us in some settings.
Yes, Ernie, you nailed it 100%. Pet parents want to see veterinary professionals as their authentic selves. And I want you all to remember the why behind why you got into this profession. Because we love animals. We love science, of course, too, but we love animals. So, I encourage you all to take your veterinary cap off and put your pet parent cap on. And when you go home to your fur babies, enjoy them. Don't palpate them. Don't worry about that lump right now. Enjoy them. Be goofy. Be silly. Get on the floor with them. And that's how I really did connect with pet parents virtually, is the fact that they love seeing my crazy, goofy, authentic self. Like, I trip, I fall, the dogs are all over me. People love that. They want to connect, and they're always just saying, like, where's your office at? We want to come to you. It's not because I'm making a promotion of a heartworm prevention, but they're loving that I'm funny, I'm authentic, I'm real. And so, to those of you that are afraid of, like, say, social media, you don't have to be on there. But the point of this is just be a pet parent. Be a pet parent. Because you know what that does? It makes you realize what they're going through. Show empathy in those exam rooms when they're worried about something as trivial as maybe a tiny, tiny lipoma, and you know that you don't even need to do a fine needle aspirate to aspirate it as such, but you should and you will. But the fact that you get them. And so I say that in the exam room too when I'm talking. I was like, listen, you're in the driver's seat. I'm in your passenger seat. And we're going to drive to make those decisions effectively together. And we're going to do it through some humor and levity, but it's going to be a great ride together. So that way you can enjoy them just as much as I want you to enjoy them. And I do think, Ernie, like, sometimes we get so caught up in the fact of, like, writing up our files and, surgeries and cases. And did I log that up? And I just want you all to go home at the end of your shift, get on the floor, cat, dog, hang out with your horse, and just be a pet parent, because there's nothing more amazing in this world than the human-animal bond. And we shouldn't deprive ourselves of that for everything that we do on the other side of that exam table.
Yeah, and somebody way smarter than me many, many years ago said, people don't care how much you know until they know how much you care. And one of the things that you certainly do a great job of is showing the world how much you care for your silly Dachshunds, right? And they are silly. Yeah. I'm sorry. I have terriers,
they are.
So,
I mean, I have a dachshund named Clark W. Griswold. Like, I mean, does it get any sillier and goofier than that?
Oh gosh, Adam, I got to tell you, we just get a chuckle, whenever they have to pick the toy. That is hilarious. So if you don't know what I'm talking about, you definitely need to check out what he puts out, because it is hilarious.
Thank you so much. Yes, I mean, again, that's my vitamin that I need every day to get my fix on to continue to be a veterinarian in practice. And I'm sure you all have that little fix that you need with your own fur babies, but never lose sight of that. Please never lose sight of that, because they want you to be silly and goofy. So take a little bit of that silly goofiness that you are as a dog parent or cat parent, and translate that over to the clients, and you have magic in a bottle.
Wow, I love that, magic in a bottle. Adam, anything else, any last bit of advice? And maybe this time let's tailor it towards that young new graduate, that young veterinary technician who, veterinarian who is sort of finding their way out. And, a lot of times they come out of school and they think, well, the only way I can really be successful is, it's all buttoned up and very serious, but maybe give them some advice so that they can embark on a long, fulfilling career and not be burned out in 5 years like so many of our colleagues, unfortunately.
Right, you're right, and I know, and that's why I'm so glad we're having this conversation. And as something as some of you may think this is like a levity discussion, which it is, but it's so crucial to our well-being. And so I want the new graduates of whatever school they're coming from to make sure that they show their authentic selves. They be transparent with their clients, and by being transparent, you show humor too. So you joke around a little bit about something like, I can't even find my stethoscope, Mom. I don't even know where it is. Just give me 2 seconds. I'm going to go find it. And it's just, and simple things like that. They're like, oh my gosh, this is so funny. Because versus like, I'm so sorry, let me shut the door and do the serious since I lost my stethoscope. Just be real, And I think that, when you're a new graduate, you're so concerned about what everyone's going to think. You're going to be judged by if you are not taking the pulses correctly or not using an otoscope properly. That's okay. I learned more from my pet parents as a veterinarian when I graduated than I ever did. And I would have pet parents who say, do you want me to hold for you? Do you want me to show you? I was like, do you mind? Do you mind just showing me a little? And they're like, yeah, I got you. And I mean, it makes for a great conversation, and you will be so bonded to these clients, and you'll feel so good about yourself without being burnt out for the long haul.
Yeah, that is a really good advice. And again, you know, we do take this seriously at VerticalVet and DVM 360, which is part of our partnership. And so we're trying to bring tools and resources to you that would help you thrive and survive throughout your career. Because, you know, Adam, I'm in the mid 50s now. And so I'm seeing, 30 plus years of clinical practice. And I see so many of my classmates and colleagues of the same, tenure, just toasted, man. I mean, they don't like life. I mean, they're like ticked off at everything. And I don't want anybody to be like that. And if there's anything we can do to bring a little bit of hope and joy to people, I mean, that's what people like Dr. Christman do. So again, I can't thank you enough for sharing your time today.
Oh, thank you, Dr. Ward, for bringing this important topic up. So this has been an honor. So catastic.
Catastic. That's right. Well, we positively love having you today, but now we're going to let everybody go and love on their own pet. So Adam Christman, DVM 360, thank you so much.
Thank you.
Well, guys, that was an amazing conversation, and there's so many gems in there. I think you may want to go rewind this and watch it about 5 times. And more importantly, maybe share it with your entire team, because if you've got a stuck-up sort of serious workplace and it's not fun, then maybe you should listen to this as an entire team. So if we can help you at VerticalVet, I mean, that's what we're here for. If you'd like to connect with our resources at DVM 360 like this and more, definitely let us know. We are here to help you sort of reinvent your whole clinic. And honestly, at VerticalVet, our #1 priority is to help you succeed in the long term. So again, on behalf of the entire team at VerticalVet, I'm Dr. Ernie Ward, Executive Director of Education. Thank you so much, and go love on your pets. Bye.